Case readouts for atelectasis. Neonatal chest and abdominal radiograph demonstrates an endotracheal tube terminating in the right mainstem bronchus with resultant atelectasis in the right upper lobe. The remainder of the lungs demonstrate diffuse fine granular opacities, which you can see in RDS. There is no pleural effusion and no pneumothorax, no myocardial thymic contour. The umbilical venous catheter terminates at the cavo-atrial junction, and the enteric tube terminates in the gastric body. No more bile gas pattern. On the follow-up exam, the enteric tube is in the stomach, the umbilical venous catheter has been slightly retracted, and the endotracheal tube is now at the thoracic inlet. The right upper lobe has near completely expanded. Single view of the chest demonstrates an endotracheal tube terminating 4.5 cm above the carina. There's a right IG line which terminates at the cavo-atrial junction. There is complete atelectasis of the left lower lobe. The remainder of the lungs are clear. There is no pleural effusion or pneumothorax. Please note that you do not see the descending thoracic aorta and the left diaphragmatic contour behind the heart. But if you look at the patient's prior exam, you can see the diaphragm sharply behind the heart, and you can also make out the contour of the descending thoracic aorta. So this shows you a clear left lower lobe, and this is a completely atelectatic left lower lobe. This case will demonstrate the different lower lobar atelectases. So if you look at this first X-ray, these lungs are clear. You can see the diaphragms sharply, you can see the cardiac contours sharply, and you can see the descending thoracic aorta behind the heart. A follow-up X-ray in the same patient demonstrates a triangular airspace consolidation in the right mid-lung zone, which silhouettes the right cardiac contour. This is consistent with atelectasis of the right middle lobe. Also note that the right hemidiaphragm is elevated due to the volume loss. The remainder of the lungs are clear. After the patient has been intubated, the airspace consolidation in the right lower lung zone has significantly increased. Now it's not only the right cardiac contour that is silhouetted at, but the opacity also silhouettes at the right hemidiaphragm, which is markedly elevated. So now we have atelectasis of both the right lower lobe and the right middle lobe. The remainder of the lungs are clear. The endotracheal tube terminates above the carina, and there is an enteric tube in the gastric fundus. On the same patient's follow-up exam, the endotracheal tube has been removed and it has been replaced by a tracheostomy. Now the right lung is completely clear. However, you can no longer see behind the heart. So we have a dense airspace consolidation behind the heart that silhouettes at the left hemidiaphragm and the descending thoracic aorta. So this is atelectasis of the left lower lobe.